It's working.
Excellent. Well, another Wednesday. Here we are. We've got Dr. Oz and Loz and Chelsey Jean, and we are here with you live, second week now. It's been great getting to meet people, who are interested in learning about how to empower themselves with their health. But, basically we are here every week coming together, having a conversation. And if you've got questions, please ask, because we will answer those questions in here. And it's all about you becoming empowered to take your health into your own hands, understand a little bit more about your body and some of the other types of things that you can do to help keep you healthy and, living a long life. Yeah.
Exactly, Loz. Yes. So hello, everybody in Boob Camp. If you're new to join, my name's Chelsey Jean, and I'm excited to bring these other two wonderful, beautiful faces to you, because this is what we want. We want to share our knowledge, and we want to be able to empower you to make changes, because we know along the way your body feels a little bit run down, a little bit yuck, and we want to give you ways to change that. So today we're going to tell a little bit of a story about that and how to empower yourself. So yeah, Chelsey Jean Lymphatics Clinic in Brisbane. That's me, but also educating all over online. And then I'm just going to hand over to Oz. Look at us, the Brady Bunch.
Yeah.
How are you? Thank you very much for being here, and thank you very much for the invitation again on this talk. I think today we're going to talk about something really interesting and something that most people suffer a lot and complain a lot when they come to one of our clinics. And I'm actually looking forward for this topic.
And so what is the topic, Chelsey? Also, my name's Loz. I'm a healthy habit coach, and I help you optimize your performance, focus, and confidence by unlocking the handbrakes that are holding you back, which is probably your eating, your breathing, your sleeping, your moving, and your hydration.
Yeah. So I think today we're talking about what happens when your body tells you no, right? No more. And it's starting to show you all these signs. And then we maybe listen a little bit, but then we keep on powering on. And Loz, I listened to you talk the other week about telling your story, and I'll let you go into that soon. But we know when there's something wrong, and how frustrating is it when we're not being heard? We can go to our GP, we can go to our friends, we can go to Google and searching for something. And sometimes we're told, and we're going to talk in the case, in my case of lipedema, talking to for the wonderful women who have got lipedema and had no idea that this was going on. And their body is getting bigger and bigger, and they look at themselves and think, what's going on? And they seek help, and they're shut down again. And then put on antidepressants because there must be something crap. They must be nuts, because, they're not listening to their GP's advice. So this is a good talk about what happens when your body says no more. Yeah. So Loz, did you want to chat a little bit about your story with that?
Yeah. And I love this topic because a lot of us experience challenge through our life, and, we go to seek answers. And especially when it comes to our own health, it can be quite overwhelming. Normally, when something happens, normally the first thing is that it's either very acute and you have to do something about it immediately, like, you've cut yourself or you've had a burn and you end up in emergency. But with a lot of disease and things, sometimes what we do is some stuff happens to our body and we ignore it. Let's be real. A lot of us ignore it, or we don't know what to do. And so we ignore it, not maliciously, but we ignore it because we just kind of are a little bit confused. It's not quite acute enough for us to go to emergency, but then we're like, well, where do I start? So normally the route is, you're feeling run down, you're chronically getting sick, you go to a doctor, a general practitioner, because you've got a relationship potentially with them, and then they go, okay, well, you need to speak to a specialist. And so you end up with a referral to a specialist. You might have to get some blood tests, some scans, some pathology, some radiography. And you kind of go down that traditional route of seeing specialists for a particular thing that's going on with your body. So, for example, if you've got gastrointestinal issues, so this is how my stuff started. You got gastrointestinal issues. You're starting to have problems with your bowel, and you're getting pain. You're not really sure what's going wrong. You ignore it for a bit. It gets worse. You then go to your doctor. The doctor refers you to a gastroenterologist. Go see a gastroenterologist, and the gastroenterologist goes, "Okay, we need to do some tests. Let's go find out what's wrong with you." So then you doctor Google everything. I can believe people who are listening to this are going, "Yeah, I've done this before." And then you get to worst case scenario. But you sort of go down rabbit holes and you see a lot of different treatments, and it's very overwhelming. You get your results back and you're told XYZ, this is what you have. And then you're treated with that using drugs and other interventions. And that's normally the solution. And that could happen in various things in your body. So for myself, on my journey, when I was in my early 20s, I started poop and blood. No way to sugarcoat that. Very, very painful. Lost a lot of weight very rapidly. I actually didn't do anything about it when I started losing weight. It took me to be poop and blood to actually go see somebody about the problem. And I remember Googling pooping blood and rapid weight loss. And some of the things that came up were cancer. So here I am, I'm thinking, oh my God, I got cancer. That makes me more stressed because you think you have cancer. And then I read all these other things about, parasites. But then there was a thing I read about ulcerative colitis. And I remember reading about ulcerative colitis, and it was so destructively painful to even imagine that I would have it. But part of me knew that I had that disease because it said there's no cure, medication. So I went down that route. And it's interesting because the way that the medical system solved my problem for that was change my diet slightly. So there were three things. Change your diet, remove gluten from your diet. It may help. Go on like a low inflammatory diet. Unfortunately, that also consisted of lots of other things that were highly processed. Number two, reduce stress. They didn't actually tell me how. They just said you have to reduce stress. Okay, righto. And number three, here's a whole heap of drugs. Didn't really tell me the side effects of the drugs. It was more that this drug will help solve that problem. The problem with that is normally when a drug does something in your body, there's still a piper to pay. So somewhere along the line, some other part of my body didn't start working as well. So I ended up getting the thing fixed that I went into the specialist for. But then I ended up with all of these other symptoms. Those symptoms for me were a lot of weight gain in a short period of time. 26.5 kilos in 6 months I gained. Steroids, so my face started to change. I ended up with moon face. I was very, very tired, and I could not sleep at night because the steroids were interfering with my sleep, but I was tired through the day. So that ended up in this cascade of other types of diagnoses. It was like depression, anxiety, as Chelsey said, and getting stuck in this cycle. So then I was referred to a psychologist, and then it was like, then this other referral and this other referral. And so the problem with that system, in my opinion, is it segregates your body into individual systems, and individual systems then get looked after by individual specialists. And that's how specialists work. Unfortunately, specialists don't talk to other specialists. And when you have conversations with a specialist and say, hey, do you think that this other system of my body might be interfering with the system that you're dealing with? They go, oh, I don't know. I don't think so. Example, I was noticing I had to see a gynecologist. So I have polycystic ovaries, which is part of that problem as well. And they told me I need to go on the pill because it would stop my menstrual cycle. That was the solution. There was no alternative. There's no alternative. It's like you have to go on some sort of synthetic hormone. And it was funny because every time I would get my period, which is every single month, my colitis would flare up. And so here I am asking the gastroenterologist, is there a reason why my colitis will flare up every month? Oh, no. Maybe, but probably, I don't know. Then the gynecologist, is there a reason that my period might my colitis flare up? Oh, I don't know. And so you're still actually stuck. And so here you are with these solutions, and you feel like you're not really sure. And so then you end up Googling again, and then you get stuck again. And this is where I love the integrated approach to wellness, which is why I've ended up down this path personally and professionally, is because it's very hard to find solutions when you're not looking at your body as a full functioning unit. Your body is a very complex machine, but different systems will affect different systems. So having an integrated approach to healing, and even things like lymphedema and lipedema and other things where it's not something that people really talk about, or it's underdiagnosed or misdiagnosed a lot. There are lots of conditions out there that are constantly misdiagnosed, or it's diagnosed as a consequence of something else. And so if we peel back the onions, the layers of the onions, and actually get to the root of the problem, you'll probably find that some of those symptoms on the periphery actually start to sort themselves out because you're treating the challenge, not the symptom. Does that make sense?
Absolutely. Yeah. And so, Dr. Oz, you've got a great background and a lot of knowledge when it comes to lipedema and lymphedema and that part. Can you just tell me what sparked your interest in those two things?
Actually, before I go there, I would actually like to make a comment on what Los just said, because I think the degree of the problem here, like all the variables on this equation has to be taken into consideration, because on one side, we have the person or the patient, how long it takes for someone to start actually taking action. Like we usually leave things till they are actually more complicated. And we can take this even further when we go like, when did you actually start having those habits that drove you to get where you are today? Like habits like eating, not exercising, I don't know, like not sleeping, drinking alcohol, smoking, all those things. At what age you started? Like, and most of the time we start all these patterns when we're on our 12s, 13s, when our parents stop taking care of or stop being like, being annoying you on you have to eat your vegetables. Like it's when you started going out with your friends, having your pizza, having your burgers and the things. So everything starts there. Then the other part of this equation is doctors. How much doctors are willing to educate people? And that's the reason we are here, because we want to educate people, because doctors are not educating people. Schools are not educating kids. I see my son going to the school and coming out every day with a lolly, with a cupcake, with something like that. When they have a special event, instead of having fruit or healthy food, they have all these pancakes and all this sugar loaded on kids that are 8 years old, 9 years old, and they start getting those patterns at that early age. Then you go to the doctor and the doctor tells you, oh, you have to diet. Okay, how? What is diet? Oh, don't like reduce stress. Okay, how? What do you like? At least send me to someone, no? Like, or exercise. Okay, do you exercise? Most of those doctors not even exercise. They don't have a diet. Exactly. They don't have the healthy habits that they're asking us to have. And then we have the third part of the equation, which is all this social media and all the information that we get. And I'm surprised with all these experts on everything. Like you get them like the expert on keto diet, the expert on intermittent fasting, and then you get all this boom, 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 and these guys attacking these other guys. So it's so much information in there that is just impossible for people to actually know what they should be doing. And the last part of the equation for me is all the other practitioners that I can divide them into the ones that are trying to do the right thing, educating people, and they believe on something and they educate themselves first and they put things on practice first. Like I always tell my patients, I won't give you something that I haven't tried myself because I don't know what's going to be the effect. I need to know what is going to happen. And I need to know that what I'm doing is the right thing. At least, again, I know that it's not always going to be the same result for you and for me, but at least I know that what I'm doing is giving this type of results. And the more I repeat this, I get the same type of results with other people. So my logic says that by doing all these good habits, you're going to get all these good results. And then you have the other practitioners that they don't care. Like I'm talking about not GPs or like other practitioners, on naturopathy and the things that they just get this amount of information and they think they know this amount of information and they give you this as this and they just confuse people and yeah, so it's a whole system here. This equation is too deep. It's too many things in there that have to be taken into consideration. And I always divide medicine in three types of medicine: good medicine, regular medicine, and bad medicine. Bad medicine is the one that we're doing, which is curing illnesses. Once people have complications, once people have chronic disease, that's bad medicine because it's the difficult one and it's the expensive one. And it's the one that people have to stop working. Then regular medicine is when you go to the doctor straight away when you start feeling something. So you're not preventing, but at least you're not allowing this to go further. And good medicine is preventive medicine. And that starts in schools. That starts when you go to your GP and you get the right information from the beginning on a regular checkup and not once you are sick.
Mm-hmm.
So which type of medicine you want to do as a practitioner? To me, is obviously good medicine, which is preventive medicine, prevent any complication, prevent anything that can go wrong. Yeah.
Mm.
And I think working together with other practitioners, and I think that like collaborative approach to care is actually key to that, Oz, because a lot of doctors are very isolated. A lot of specialists, they sort of stick to their own practice. They don't really look outside their scope. And then at the other end of the spectrum, as you mentioned, you've got a lot of people out there who know this much but presented as this much. And so the problem is those people are constantly working beyond their scope. And so then you've got this conflicting information. And then so people don't do anything until it's too late. Actually, I just watched a documentary last night on Netflix called Fed Up. It's old, but it actually talks about interventions with health at a school level for kids as well. And, you know, some of the things that have happened historically where, you know, big food have sort of intervened and stopped things from progressing the way they need to because they have so much control. And so just because something is right, it ends up being wrong because you've got big puppeteers, you know, making the calls, and then it filters down to society. And this is a lot of the reason why we have so much dis-ease. And if people could learn how to empower themselves and make better decisions, they'll be able to, you know, do the stuff they need to proactively prevent a lot of this stuff from arising anyway. Which is why we're here.
I'm going to throw in a little bit of Loz's French here. So if you don't like French, then stick your fingers in your ears. But I went to a Kerwin Rae event last night about business, and just what Dr. Oz said, the way that Kerwin divided the business up can be same as our health. We're either pre-fucked, fucked, or totally fucked. So the 3 stages of health. So, you know, those three things in business is the same with our health. So we need to catch the pre, right? That's where we need to catch it. We don't have to hit rock bottom, but stay inquisitive, like to be able to keep going when you get knocked down and not listened to and not get any answers back. You know, because GPs really have got so many things on their plate. And how many minutes do you get with them?
Exactly. 15 minutes.
15, yeah, I haven't been to 15 minutes, 10, 15 minutes you get, and most of that's writing out a script. And it's, so to be able to be listened to and then not just passed on to, oh, here's a specialist or here's a this or here's a that. But just to be able to give yourself a great pat on the back for continually listening to your body and say, hey, I know that there's something going on, or there's something that I need to change. And we're not dumb. Like, we know, you know, if you're eating the wrong foods, you know at a basic level that having takeaway 5 days a week isn't great. You know that you're supposed to drink water. Like, you know that you're supposed to move your body. So those things you can actually do to see whether they make a change. But when it comes to when you're doing those things and you're sleeping, Loz, and you're exercising and you're eating well, and you still aren't getting any changes, that's when you have to really persist, you know, and you get one life, one body, and you give it all to feeling better. Because if you don't have your health, you know, it's
nothing matters.
You're totally fucked.
Yep. And no amount of wealth is going to save you. No amount of hard work is going to get you unstuck, because without your health, yes, you can buy 24/7 care, but probably you'd rather be doing stuff with your life. So, you know, I think having those conversations and feeling comfortable having those conversations and actually catching people out and going, you know what, you're not giving me the answers that I want.
Yeah.
And having the confidence to be able to say that to somebody, even somebody who's supposed to know more than you, you know, and it's kind of getting to the root of that problem, which is, you know, taking those layers off the onion, which is you, and getting to the root of it. And that could be that you've got high levels of toxicity going on in your body, which come from something decades ago. you know what I mean? It could be something that you're doing every day or something that you're eating that might be healthy because, you know, that's where it fits on the food pyramid. But actually for you, your body isn't understanding what to do with that. And so it's giving you, it's upregulating your inflammatory hormones.
Mm.
And now you're responding to everything from this opposition, this point of defense constantly. And so even with all of those other things happening, it's still that struggle. And so this is where having conversations with people that actually go beyond the superficiality and the Band-Aid effect can be very useful, and doing proactive things like understanding your lymphatic system and its role in your body. It's huge. Like people do not talk about it. People do not talk about omegas. People aren't talking about this stuff because it's not actually taught in mainstream medicine, is it, Oz?
No, it's not. And the other thing here is, as a patient, asking the right questions, and don't be scared of asking those questions. When my wife got cancer, the first question I asked the first oncologist was, if your wife were having the same problem as my wife, would you offer her the same treatment? And he said, this is not about my wife. I said, okay, thank you, goodbye.
Yeah.
If you're answering me that kind of, you're giving me that kind of answer, that's telling me that no, you won't give this to your wife. So why should I give this to my wife?
Mm-hmm.
Right. So don't be scared, because sometimes asking questions, doctors get in a hurry. They not paying too much attention, or they're too stressed with all these other patients that are waiting for, and they don't answer the question, or it looks or seems, or you feel like they don't want to answer your questions. You are paying for your time in there, and it's your body at the end of the day. You have to take that part of responsibility of asking the right questions, but also taking the responsibility of, okay, what have I done all this time to get where I am? So, and what can I change before I even go to the doctor? Because maybe those little changes that you do, as Chelsey just mentioned, in 1 week or 2 weeks will make a huge difference on your condition. And then when you go to the doctor, it's much, much less what you have to do. So taking that part of responsibility, I think, is too important here.
And I think people underestimate just the power of those simple daily changes. Like, you've got to remember where you are right now in your life and the things that are showing up for you and the symptoms, they are symptoms of something else. And so if you can continue to do the same thing and make the same recipe using the same ingredients, but you expect a different outcome, you are crazy. That is insanity. You can't get different results if you've got the same inputs. So if you want a different output, you have to change the inputs. And that could be something as simple as, okay, how is my sleep? Like right now, I'm really, really run down. Am I getting 7 to 8 hours sleep a night? Now, I know there's somebody who is on this who is not getting that, but if your sleep is continuously the thing that's holding you back and you've got no way of measuring that or understanding it, maybe that's something you could look at. Or something like eating. You know, if you are only eating 1 time a day and that meal is just quick and easy because you haven't prioritized it and you are feeling like shit, probably something you could do would be to improve what you're doing eating in the day. And you might find that symptomatically, all of a sudden, by optimizing that, something else unlocks and you're not feeling as sick. And so by the time you get to the doctor, okay, some of those symptoms have resolved. And so it's about actually not externalizing the blame as well, and actually taking responsibility to some degree for where you are. And look, it's not always your fault, but it doesn't mean you can't do something about it. I was exposed to toxic mold as a kid. That's not my fault. And I swear that's a lot of the reason why I am so sick chronically now as an adult. And that's okay, but there's stuff I can do about it. And I've just had to come to terms with the fact that that happened. And okay, I've got to move on. What can I do? What can I do? Or I could wallow in my sadness and play woe is me and just continue down the path of destruction. But, you know, ultimately we do need to take our health into our own hands.
Yeah. Okay. So we've got just a little 5 minutes or so left. Can we just delve into lipedema, please, guys? So, so lipedema and lymphedema, 2 different conditions, but they can also, one person can also have both of them. We're finding in clinic that like a lot of women don't even know until they're in their 40s that they've had this for a lot of their like since puberty that they have this condition. So Oz, did you want to talk a little bit about lymphedema and lipedema? Because a lot of people in here have heard me talk about it, but I'd love for you to have a chat, please.
Well, we know that lipedema is a genetic condition where your body stores fat in an abnormal way, most of the time on the area of the legs, could be arms, could be sometimes in the abdomen. The most common thing is to see on the legs at different stages. And the main thing that makes lipedema difficult to treat, one thing is obvious that it's genetic. That means your body is creating that fat, even if you have a really clean diet, and storing that fat. But one of the difficult parts of this in terms of the treatment is that fat is usually protected by fibrotic tissue. And that fibrotic tissue won't allow other therapies like radiofrequency or fat freezing to actually get rid of the fat. And that's the main mistake. Misdiagnosing this, thinking that it's just cellulite or fat, is what is making most of these treatments unsuccessful, and think that these treatments are not useful at all. They're useful with the right diagnosis. If we go back to that part, you need to know what you have, so you know how to treat it. Lipedema is a condition that doesn't have a really way to diagnose. Like, we just do it according to symptoms, according to some history, but it's not a physical way to diagnose. There's not an ultrasound technique, there's no x-rays, there's no MRIs, there's nothing that can actually diagnose that so far until now. And yes, the treatment, because of that extension of fibrotic tissue, has to be something more invasive, more aggressive, which is liposuction, which is not a normal type of liposuction. It's a specific type of liposuction where they actually cut the matrix of the cells that are creating this abnormal fat to grow.
So how important is it that we can spread the word, educate, and catch this early? Because if we can catch it early, because there's different stages, if we can catch it early, then we don't have to progress through the other stages, yeah?
Well, it is important. We go back to the prevention part. Like, once you start seeing something abnormal, and the main, I guess the main problem is that early stages of lipedema will look a lot like cellulite, and for more women and for more doctors will be, oh, that's just a cosmetic condition that doesn't need to be treated. I have been treating cellulite for 20 years now, and I can tell you that cellulite is not a cosmetic condition. It's actually a condition that it has the 4 stages of chronic disease, and there's a lot of things happening there. So it looks like cosmetic because obviously it's on your legs, but it's not a cosmetic condition. It's actually a previous stage to chronic disease. So it has to be treated. So if people start, or women start getting that appearance of cellulite, it's going to be difficult to distinguish at that stage if it's cellulite or if it's lipedema, but still having the treatment will tell you, like, if it goes away with the treatment or reduces the appearance with the treatment, that means that it's cellulite. If it doesn't, then the practitioner should have the idea that, okay, if it's not going down, that means that this could be lipedema. So there are other measurements that you can do, and you know those ones, which is lymphatic drainage, which is stockings, compression stockings, and things like that.
Yeah, so that's what our main goal here, when we have ladies come in, and I've got a pretty good eye of noticing it. Like, you can see on somebody's body where the block sort of starts of their legs. So they, the legs can come up normal from their ankles and then sort of have a block, a heaviness sort of start, or they might be heavier down below too. So you can see a channeled look on legs, and to touch can be sore as well. So the feeling can be sore. And a lot of women would exercise. I've had them like become anorexic and starve themselves and be tiny up the waist and still have these big legs, and not knowing like just not knowing. So what we focus on is definitely helping with diet, the anti-inflammatory diet, and to keep like toxins low, and grains and milks and all of those things. We do a hair test to find out exactly what our clients can eat and can't. We use the gloves all of the time with lipedema, because we want that tissue to stay as soft and pliable as possible. And we use our compression pants, our Circulate compression, and just keeping that movement and that flow and that tissue as healthy as possible is the main, and preventing then any more keeping the pain down. So we're noticing that our ladies, their pain is going down. But one of the big things is for women who then find out that they do have something wrong with them, that it is a condition, and it's like the relief. Like, they've spent years thinking that they're fat and that they just must be, they must be doing the wrong thing, and, that they're crazy and all those things. And then the relief, even though it is a condition that if they want to get rid of it, it does require surgery. But just finding out that they've got something, and then owning it. Like, I love it. Like, they come in with skirts on, but they come in with shorter skirts or with shorts, or because they're like, you know what, I'm going to own it and I'm going to rock it. And I just, the love I have for them, watching the journey is amazing. And then teaching that they so want to educate, and their kids, they want to find out what's going on with their kids or their nieces and family about, and educating more. So like the group of women that are finding out and then helping and educating about lipedema, and then hopefully we can make it into something that Medicare will notice, and that the surgery may become, subsidized a little bit, or like some financial help for, for treatments.
And I think we're still a little bit away from that, because the system does have to catch up. And it's the same with a lot of conditions. We're still waiting for the system to catch up, unfortunately. They're still in a very much a reactive, not a proactive stance. Yeah. And so just before we finish, like, what is the inherent difference between lipedema and lymphedema? Because I think a lot of people get them confused because they sound so similar.
Yeah, Oz, did you want to do this one?
I think you're the more.
Yeah, okay, all right. So lymphedema and lipedema. So lymphedema, so Dr. Loretta, who I speak to a lot in the US, she calls lymphedema a blockage of toxins not being able to get out of your body. So lymphedema mainly is secondary. It mainly happens from either an accident or from lymph nodes being removed out of the body. So whether that's from cancer, normally from cancer, right? So let's just stick to what we know. So normally it's from breast cancer, and then just say if the doctor removes nodes, all of these, we have 300 lymph nodes all through our chest, another 300 or so in our belly. But if those lymph nodes get removed from the breast, from the tissue from after a mastectomy, then the fluid that has to come up through that arm has less nodes to go to. So nodes are like a security checkpoint where the body's like, okay, will I let this fluid through? Is there anything bad there that I need to keep in check? So with less of those security points, the fluid is going to back up and back up and back up in the limb. So arms to do with mastectomies. I had a client who had an accident. She was riding a push bike and she slipped and the seat went into a groin, enough to damage the lymph nodes. And then, so her whole leg, she got lymphedema in her leg, just swelling up because it just took too long for that fluid to be able to process up throughout the body. So we're finding that that we're controlling lymphedema, and we're also reducing lymphedema, which is like super cool. But the body can reroute pathways of how fluid needs to go. Like, I had a lot of my veins stripped out, and the the body just makes new ones. Okay, so when it comes to fluid and things moving around, the body is super cool, but you need to be able to help it. And that's where the brushing with the gloves come in. So that's a quickie on lymphedema. And then lipedema is that, toxic fibrous fat that just blocks and stops that lymph fluid moving through. We have 15 liters of lymph, right? It's super, there's so much of it. So then if the fluid can't get through again, what's it going to cause? The swelling in the next, in the limb, in the area as well. So then we go through the stages of having lymphedema brought on by the lipedema congestion in the body. So hopefully that makes sense, and we can go into it a little bit more. There's lots of information here in the Boob Camp group where I talk about of the lymphatic system. But really, so those two conditions, like 1/3 of women who have a mastectomy ends up with lymphedema.
Wow.
1/3. They are not told. They get 1 hour with a breast care nurse, right? And can you imagine sitting there being told that you've got cancer, being told now that you're going to have whatever procedure that the doctor comes up with, and then a nurse saying to you, oh, you need to do this, like after, when is that going to go into the brain?
I think it's a good topic for next week to go more in depth on how the lymphatic system works and the different, because this is one thing I get, like my wife getting cancer. She got lymphedema after radiotherapy, and she got a really good lymphatic drainage massage from a physio. But after that, going to many other physios or other people who claim themselves to be lymphatic drainage massage or something like that, you could see the difference. Like that's not like, that's too deep to be like, because the lymphatic drainage has a specific pressure, which is different than the veins, which is different than the arteries. So the compression stockings that you need is different. The compression when you're doing the massage is different. So all the things are important. There are so many people doing lymphatic drainage massage that are actually blocking more than actually draining. So that's something that I think is a good topic to go through.
And there's so many little variables. And I love that you mentioned that about the pressure we have in the mobility store that I own. People coming in for compression garments and they actually don't really know what they need. And, you know, that because they've just been told they have to get a compression garment. And it's like there are multiple levels of compression. Like, do you need a class 1? Do you need a class 3? You know, it makes a difference because, you know, it's different grades of pressure at different depths. And it's like, well, if you get the wrong one, it could actually make it worse.
Yeah. I went to the mower shop on the way here to work this morning. I had to get a new piece for my my steel gurney. And I noticed the man behind the counter has a pressure stocking on. And, you know, I would love to, and I said to him that, I said, oh, quick, I've only got 10 minutes. I need to get on, get to work and do a show. But I said to him, I'm going to come back and explain to you why you need to start massaging through your chest and breathing to help that, the swelling that you have in your leg. So this is not just a women's thing, like men and circulation, massive, conditions as well.
So much we could talk about, guys, but I think for today, we've probably given people a lot of good golden nuggets of information, and maybe we've opened up your eyes a little bit more about some of the things you can do and to understand lipedema, and maybe it's something that you know somebody who has some symptoms and they have been misdiagnosed, or maybe they're not even in a position to even think about it. They're worried that it's just fat and they're trying to do all of the things and nothing's working. So this may just open their eyes up to be able to ask some questions. And guys, question everything. As we said, question everything.
Yeah.
Absolutely important. So we'll be back next week. Same time, same place. We'll be live streaming into the Boob Camp group as well now. And if you are watching this on replay, hi. Thanks for joining us. Hey. But we'll be back next week and we will dive a little bit deeper into that conversation. And if you've got any questions, please, as always, field them our way in the group, by DM, however you need to. We will answer your questions live here every single Wednesday. Thanks for hanging out, team.
Thank you very much. I love it. It's the best day of the week for me.
Sure
Connecting
is.
with
And,
you too.
and it's hump day. And it's hump day. So, yeah, guys, thanks, Joan. Thanks for the message. And ciao for now. See you soon.
Bye.
Bye-bye.
Bye.